Well, it's time now for Health Report, and joining us now is Africa 54 health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Tuberculosis is a worldwide epidemic that each year kills 1.5 million people. Healthcare workers are on the front lines of this epidemic. According to the research TB Unmasked by Aeras, up to 80% of TB cases among healthcare workers can be connected to their work. For more on the subject, I'm joined by Dr. Schrager, Vice President for Scientific Affairs with Aeras, global nonprofit biotech based outside Washington, D.C. Thank you so much for joining us, Dr. Schrager.
Pleasure to be here. Thank you.
Also joining us live via Skype from South Africa is Dr. Uvistra Naidoo, a practicing physician in Durban and a survivor of multi-drug-resistant TB. Dr. Naidoo, thank you so much for joining us.
Pleasure. Thanks for having me.
Let me start with you, Dr. Schrager, and I would like to start with some numbers. Healthcare workers are 2 times more at risk of being infected with TB in the United States, 5 times in South Africa, and 5 to 11 times in India. It is a serious problem.
It's a major problem for healthcare workers. It's a real issue because the healthcare workers obviously are on the front lines. They are necessary to be treating these patients, and they're putting themselves at risk.
Absolutely. Now, Dr. Naidoo, let me come to you. You were infected a few years ago. You went through 3 years of treatment, a little over 3 years, and about 20 pills a day. What was this experience like? Can you share your story?
Well, I think we work in a system where you're primed to be an academic at the end of the day and look at patients and sick patients. But when you're at the receiving end as being a patient, I think you get to see the shortfalls of the system, particularly where we're in a very scientific, competitive academic world. Whereas I think we lack a lot of empathy, and it was a real humbling, eye-opening experience for me. My treatment lasted 3 years, 1 week, and a day. And it was wrought with many complications, which was what kept me in tuberculosis work thereafter.
Well, we are glad to know that you recovered from this. And Dr. Schrager, Dr. Naidoo mentioned the shortfall of the system. Shouldn't healthcare workers be vaccinated against TB? There is a TB treatment, the BCG vaccine. Are they being vaccinated? Is it mandatory, or shouldn't there be?
So a couple of things that is important to understand. BCG, while it is a vaccination for tuberculosis, is only indicated to prevent serious tuberculosis in infants and young children. Okay. It does not prevent infection or disease, to the best of our knowledge, in persons once they get past 9 years of age. That's why we have such a big problem with TB globally. If there were to be a vaccine, it wouldn't have to be mandatory. Healthcare workers would be demanding it.
Now, Dr. Naidoo, after going through this experience, what is your sentiment in terms of the way this should be addressed with regards to healthcare workers? There is no vaccine for, at least with regards to addressing adults, a good vaccine out there, and perhaps that's where Aeras come in. What is your sentiment on this issue?
Well, I think it's a vital area in research and continued work in tuberculosis. If we don't have our frontline workers in any setting where we are tuberculosis afflicted, how can we curb the fight against it at the end of the day? A vaccine ultimately would ensure protection of healthcare workers, but also just help bolster their motivation to keep working. At the moment, no matter where you work in the world, a healthcare worker would always put himself out in the front line against a patient that is terribly ill. I think this would be an extra piece of armor that would really help the fight at the end of the day.
And we've seen the risk of healthcare workers with regards to the Ebola crisis. We've seen that as well. Now, we talked about vaccine. Aeras has been working on developing a vaccine against TB. Where do we stand, Dr. Schrager, and what are the roadblocks? Because it's been a few years now.
Right. So we stand by we've made enormous progress so far. If you look 10 years ago, there was only 1 vaccine candidate in clinical trials. Now we have 13 candidates in clinical trials. That's amazing progress in just 10 years. But a roadblock one major roadblock is that we're still trying to figure out what kind of immune response is necessary to actually prevent or protect against tuberculosis disease and infection. We're working very hard to figure that out. Another important roadblock is that we don't have what's called a human challenge model where we could safely vaccinate volunteers and then challenge them with a very benign type of tuberculosis to see if the vaccine worked. We have that kind of model in malaria and many other infections, and we're working very hard to develop that in tuberculosis, but we're still a number of years away from that.
Dr. Naidoo, you are a practicing physician. You come in contact with patients, perhaps TB patients. How do you protect yourself? What are you doing differently this time around that you didn't do before?
As a pediatrician, I look after sick kids, and kids don't have a very high burden of TB, but their parents that look after them do. So I'm always in the firing line against these bugs. Ever since my TB ordeal, I wear my N95 mask religiously. Okay. But to be honest, it isn't something that's very practical. You can't talk to a patient. You can't get that human experience of trust at the end of the day with this mask on. And in South Africa, where I'm practicing, the majority of doctors actually still to this day do not wear their protective masks, just out of that human connection with the patient. And I think that's something we should be addressing. But at the moment, I do still live in fear of that bug coming every single day. But it's still a fear that I have to overcome. But you got to stay and do what you love at the end of the day.
And now Aeras, Dr. Schrager, produced a series of 5 short films in the TB and Mask series showing the risk of healthcare workers. Now, the last film featured actually the head of the United States CDC, Centers for Disease Control, Dr. Tom Frieden, who tested positive earlier in his career and had been treated as a precaution since. What was surprising or perhaps enlightening during this work in putting this film together and investigating for this project?
Well, one of the enlightening and really uplifting aspects of doing it is learning the stories. I mean, learning Uvi's story and learning the stories of others that are putting themselves at risk on the front lines and are still willing to take care of patients, are dedicated to taking care of patients, and are supporting our efforts to develop vaccines, because as we've discussed, I mean, that ultimately would be the key armor that would be protecting healthcare workers.
How long do you think it will take to have a vaccine?
Very difficult question. Obviously, we're trying our best to have it happen as soon as possible. This is a very challenging organism, but we're making real progress. I'd love to tell you 10 years. We're hoping something like that, but you have to test. That's why we do these trials, and we'll hope for the best.
Absolutely. And Dr. Naidoo, if you're still with us, I wanted to ask you, what do you hope to see moving forward?
Just a more positive world. I think having companies like Aeras putting forward vaccine trials, it makes us hopeful. I look at TB has been around for the last 70,000 years. And I always say that it's that humility that we need as human beings. We think we are dominating this world, but I think how mistaken we are. But I think it's a way for us to come together and work more positively forward. Vaccines of the day offer a lot of hope. So I'm very hopeful.
And Dr. Naidoo is very hopeful. What about you? Vaccine is the way to protect healthcare workers. What is the way forward then?
So number one, I am also very hopeful. And the way forward is to continue doing research. We need to have a lot more preclinical research. We could use a lot more funds for this. There are a lot of type of experiments and work that we could do. We really do need more funding, more support. These trials are expensive. They're difficult to do. But we're committed to doing them and to moving a vaccine candidate into the clinic and hopefully get it licensed as soon as possible.
Now, Dr. Naidoo, can you give us a sense of the type of TB? We hear about MDR TB, XDR TB, TB in general. Can you just briefly explain to us the difference?
Well, basically, TB is a bacillus. It's a bacterium which we have traditionally used for antibiotics to treat them in the past. Since we've had our advent of antibiotics since the peri-1930s, we haven't changed that regimen since. So basically, we've been using 4 drugs: rifampicin, INH, pyrazinamide, and ethambutol. As time has gone on, the bug has developed immunity, and we've developed multi-drug resistant TB, which is a resistance to our antibiotics with rifampicin and INH. XDR TB, or extensively drug resistant TB, is the same definition as multi-drug resistant TB, but it adds on resistance to some multi-drug resistant TB antibiotics, such as fluoroquinolones and injectables that we use for patients. So basically, the bug is evolving to be much stronger. And as you go from ordinary drug-sensitive TB to drug-resistant TB, the duration of treatment is actually prolonged. And that is our difficulty at the moment, to actually get patients adherent to this. In the face of HIV with the TB pandemic, it's proving very trying as a clinician these days.
And the HIV/AIDS pandemic has really made treating TB a great challenge. So when you work on developing this vaccine, to what extent HIV/AIDS is a factor in this?
Oh, it's a huge factor. I mean, the vaccines that we develop need to be able to be used safely in HIV infected individuals. But I also want to get back to a point that Dr. Naidoo raised, and that is that with multiple multi-drug resistant tuberculosis, with extensively drug resistant tuberculosis, it's important to understand that drug resistance does not mean vaccine resistance. So that the vaccine should be able, once we get one that actually protects, to protect against all types of TB, whether it be drug resistant or not. Terribly important point to understand.
Okay. Now, as a pediatrician, Dr. Naidoo, do you still administer the BCG vaccine? At what point do you do that, if you do, for children?
In South Africa, it's typically given at birth, provided a child looks immunocompetent. But it's generally a bug that protects you in your infancy. But as Dr. previously had mentioned, that it protects you against the severe types of TB. But as you get older, that immunity is actually wanes over time. So it actually confers no immunity as you become an adolescent to an adult. So although it is still used, it does offer protection from severe forms of TB when you are very young. But currently, we're facing a much bigger problem than just the young people in the world at the moment with TB infection and disease. So hence the BCG is not very helpful.
Okay, Dr. Naidoo, thank you so much for joining us from Durban. Dr. Schrager, it was a pleasure to have you.
Pleasure, thank you very much.
And that was Dr. Schrager, Vice President for Scientific Affairs with Aeras, and MDR TB survivor, Dr. Uvistra Naidoo. That's our Africa Health Report for today.